This is the Pet Buzz.
This is the Pet Buzz.
And here's the Dynamic Pet Duo.
Okay, so everyone check this out. A new canine sleep study from North Carolina State University could serve as a baseline for research on chronic pain and cognitive dysfunction in dogs, potentially improving detection and treatment of these conditions.
And joining us today to talk about the new study is Margaret Gruen, Assistant Professor of Behavioral Medicine at North Carolina State and corresponding author of the work. Dr. Gruen, welcome to the Pet Buzz today.
Thank you. It's nice to be here.
We're excited to have her.
We are really excited. This is an interesting study.
Yeah.
So why study the sleep patterns of dogs?
Well, I think we can all agree sleep is just of really fundamental importance, and understanding what sleep patterns look like in normal dogs will help us to be able to look for changes in that normal pattern and how these patterns develop in young dogs, how they change over time, and how those changes might be associated with disease states in dogs. So there's some exciting newer research that's providing insight into sleep stages in dogs, but that fundamental research on the sleep-wake cycles was pretty old, or it was performed in laboratory dogs. And we know that dogs' activity is affected by human activity. So comparisons with laboratory house dogs was not as helpful for studying naturally occurring diseases in pet dogs.
And that research, that prior research was like 20 years ago, correct? So it's like super old.
Nobody cared.
Well, and the technology was different.
Yeah, and I don't think people really thought about it. I mean, for the last 2 or 3 years, all we've been hearing about is sleep, how humans can't sleep.
Yep.
The stress triggers of sleep. I mean, they're making CBD products and THC products for sleep. So now we're going to get down to it and talk to Dr. Gruen about the dogs. Okay, so how does the sleep pattern of dogs relate to research on chronic pain and cognitive dysfunction in dogs? Because when I was doing the research, I didn't really see so much the correlation. I mean, when I read the study, yes, but prior for some of the articles. So if you could talk a little bit about that, because I know our listening audience is going to want to know that.
Sure. So it's really important for both dog health and the veterinary science, and then also thinking about dogs as how they relate to human diseases. So chronic pain, we know there's impairments in sleep with that in both dogs and in people. So dogs develop chronically painful conditions like arthritis, and some of our prior work showed that dogs will sleep better. Dogs with arthritis will sleep more soundly or less restless when they're receiving an anti-inflammatory medication. So we know that that's similar between people and humans. And then in cognitive dysfunction in dogs, one of the hallmark signs is the change in the sleep-wake cycle, which we talk about as being kind of awake and restless during the night. But without really knowing what the normal sleep-wake cycle is, it's hard for us to be able to detect what a change would be, especially at an earlier stage, which is what we're hoping to be able to do.
Yeah.
Yeah.
You would expect that too.
I could see where this is going.
Yeah.
Okay.
Yeah.
You had a question.
So how did you conduct the study?
So we recruited dogs from the local area, and we had them come in with their owners. We did a brief health check on them. They filled out some questionnaires, and then we had them have a collar-mounted activity monitor. So it's just a little monitor. It weighs about 18 grams. It attaches to their collar, and they don't even really notice that it's there. And it collects activity, a count every single minute over every day for 2 weeks. And then we analyze those activity counts to look at that kind of average activity over time and what different factors affect that pattern.
Now, were there a number of dogs, sex?
Yep. So 42 dogs were enrolled in the study and completed the study. There were 21 males and 21 females. So we were pretty nicely split there. And they were healthy adult dogs. So they ranged in age from a little over 1 to about 9 years old.
So these were conducted at home with the monitoring?
Mm-hmm. Yep. They just wear them throughout their normal day. And the owners filled out a few questionnaires for us, and then also made any notes of, big things that happen, like if the collar came off for a bath. But otherwise, they just went about their normal day.
Yeah, because I understand the earlier studies were done in the lab, so to speak.
She said that. Yeah, with
so
laboratory dogs.
having it done at home, people can say, yeah, that's what my pet's doing.
Okay, so what were the results? What were the findings?
So we did 2 types of analyses, one that looks at kind of an average over the day or over periods of time, and then a second more exciting one that was a collaboration with University of Toronto, where we were actually able to look at the pattern of activity across the day. So instead of just averages, it lets us look at exactly when changes in sleep-wake patterns were occurring, and then look at what features and factors about the dogs are there, about the dogs were affecting that pattern. And we found that the dogs have 2 peaks of activity, which we sort of expected. So they have a morning peak of activity between about 7 and 9, and then they have an evening longer peak of activity about when people would get home from work, so 5:30 to 9 or 10 p.m. And then they sleep during the middle of the day and during the night.
Yeah.
That seems normal. I mean, that's when the humans are home, so you would kind of expect that they would get excited.
Yeah, it
The
seems like our experience
anticipatory
of,
nature.
seems like that's their experience of watching our pets.
Yeah,
That's what
I mean,
they're
I
doing.
think so.
Mm.
Okay, so what other factors affected sleep patterns of the dogs? Any specific characteristics of the pets in the study?
Yeah, so we found even within this group of healthy adult dogs that the younger dogs were more active during the peaks of activity. So they had higher activity counts during that time. Not significant, but we could start to see a shift in the pattern for the older dogs where they were going to bed a little bit earlier and waking up a little bit earlier. We also saw that the lighter dogs had a peak of activity during the night that was different from other dogs. We don't have a great explanation for that.
You mean
But we
lighter
did
in terms of weight or
weight.
color?
Yes,
Okay.
weight. Yes. And then the female dogs were more active than the male dogs, especially during that evening peak.
Oh,
They
that's
were?
interesting.
Yeah.
Yeah. No football. They weren't
No.
out there playing Maybe the girl dogs were out there playing football.
Well, the guys are on the couch, so are the dogs.
Yeah, I
Doing the
guess.
dogs. Yeah, watching the ball games. You're right.
Watching the news, whatever. Okay.
Okay,
You can see what Dr. Fleck's favorite habit.
So, do we see a correlation between the sleep patterns of dogs and humans, maybe as it relates to chronic pain and cognitive function?
That's what we're hoping to get at. That's kind of parts 2 and 3 of the work that we're doing. So we really are interested in now that we know what normal looks like, how can we start to detect changes from normal, and how do those correlate with our other measures for chronic pain or cognitive dysfunction, so that we can really start to get at that, because earlier diagnosis would be really fantastic for the dogs and for their owners.
Yeah. So, I mean, this really was just the first approach. This was the best baseline. So, as she said, parts 2 and 3 are coming.
Yeah, I can't
Okay.
wait till they come.
So, I guess really what I want to know is how this information helps the average dog owner or even practicing veterinarian like yourself, Dr. Fleck.
Yes.
Right now, I think we need some more work before it can really be applied to looking at, more subtle changes in sleep-wake patterns. I think, right now, big deviations from this pattern would probably be important to talk with your veterinarian about. But we're hoping to be able to look at what are the more subtle signs when we start to see shifts, and is that important in predicting disease states in dogs. I think for right now, with everybody home with dogs all the time, it's important for us to think about that pattern and what that means about how much sleep dogs need and when they need it. So making sure that, with all the increased activity in the home, with people home, that they're getting that sleep that they would normally get during the middle of the day. So allowing dogs to have that kind of rest time is probably really important for them.
And you know what it sounds like? The pet parents, as well as the dogs, can't wait for those kids to go back to school so they can go back to sleep, right? I think so.
Well, Dr. Gruen, we really appreciate your coming and sharing that research with us. I can't wait for the follow-up studies.
Yeah, I think it'll be great.
Thank you. It was great to be here with you.
Thank you for listening to this episode of The Pet Buzz.